Good afternoon, Barry G., Houston's dancing psychiatrist. Today we're going to be talking about the brain zaps or antidepressant withdrawal discontinuation symptoms. People ask me frequently, am I addicted to my medicines? Are these medicines addictive? Why do I get the brain zaps? These are questions I get. So we're going to be talking about that. First of all, when we stop taking a medication that increases serotonin, whether it's an SSRI, selective serotonin reuptake inhibitor, or an SNRI, which is a selective serotonin norepinephrine reuptake inhibitor, when you stop the medication abruptly or you lower the dosage quickly, too quickly for your body, we can get short periods of a condition called antidepressant withdrawal syndrome or antidepressant discontinuation syndrome. This is really not meaning your body's addicted to it. It means that your body is taking time to adapt to the lower dosage or the absence of the medication. It's not the same as being addicted to it. When I think of addiction, I think of craving, urges, behaviors that are leading to extreme euphoria or a euphoric sense of needing the drug to achieve this enhanced euphoric effect or craving for it. This is actually a physiologic withdrawal syndrome of your body adjusting to the lower levels of the medicines. It's different from an urge to use, which is more that what you're talking about more is when we talk about addiction is we talk about frequently dopamine and the nucleus accumbens and other pathways. What are some symptoms that might indicate that somebody is experiencing serotonin withdrawal syndrome or serotonin discontinuation syndrome or antidepressant discontinuation symptoms? Good question. I'm glad y'all asked. The symptoms are as follows. Patients can describe lightheadedness or dizziness, which is probably the most common side effect. They can get a feeling of what we call the brain zaps or electric shock sensations in the head, nausea or upset stomach, headache, fatigue or feeling tired, insomnia, or feeling flu-like, achy, myalgia, kind of like the muscle aches you have with the flu. People could also have emotional symptoms such as irritability or agitation, anxiety or nervousness, or mood changes. These symptoms are not necessarily a sign that your depression is returning, although they can occur with relapse. How do we distinguish between whether this is a relapse of depression or serotonin withdrawal symptoms? Good question. I'm glad y'all asked. The way we determine that is generally the withdrawal symptoms stop within they begin at 2 to 4 days after stopping the medicine. Sometimes they can start even quicker with the shorter acting antidepressants. And do they stop within 1 to 3 weeks of being off the medicine? If the symptoms continue after 3 weeks of being off the medicine, then I think it's recurrence of symptoms. And then I'm going to probably try to encourage the patient to either get back on the medicine or to switch to a different medicine. But if these symptoms are occurring during the withdrawal symptom, the discontinuation symptoms, they may simply resolve if the patient stays off the medicine, or if you speak with your clinician about slowly decreasing the rate of the taper of the medicine. That can help a lot too. So that's the things to think about. And how can we minimize these or prevent these symptoms? The best way is to work with your clinician on tapering the medication slowly, not abruptly stopping the medicine, not running out, and not tapering too quickly. And we frequently, if my patient's been on the medicine for a while, we may taper over a course of weeks to months rather than over a course of days. And what other things to think about is it depends upon the half-life of the drug. The half-life of a drug refers to how long it takes for your body to eliminate half the amount of that drug. Long-acting drugs, like there are certain serotonin drugs that are long-acting, they have a minimal discontinuation syndrome because they kind of taper themselves. But a lot of the drugs we use, a lot of the medications we use, they have a shorter half-life, and thus they have more risk of this antidepressant withdrawal syndrome, this antidepressant discontinuation syndrome. I hope this was helpful. What I always encourage you to do, go speak with your clinician and have these discussions. But even though antidepressant discontinuation syndrome can feel very scary, it is not medically dangerous. Unlike certain medications that if you stop abruptly, you could actually die from the withdrawal. This, you could feel very poorly, but you will not die from serotonin withdrawal from the antidepressants. But this is a discussion to go have with your clinician. And this is Dr. Barry G, also known as Houston's Dancing Psychiatrist. Check your schedule, see if you can join me Friday morning for Aqua Zumba in the Meyerland area, or Land Zumba in the West Houston area. That is Eldridge and Briar Forest. Y'all have a good day.